Hey, everybody. Thanks for stopping by. This is the Office of Housing and Homeless Services. We're so happy to bring this conference to you today. I've got my teammates here with me in the room, Christy Spangler, Felicia James, and Tessa Antonelli. We are all great leaders in this office. I'm just going to brag a little bit about it. And we're just here to talk a little bit, have a quick conversation. I hope you just listen in. So I want to start off by talking to you guys about our flagship program. That's the Creating Homes Initiative. You guys have heard that. There's a session today about it that we're going to feature. Thanks to Commissioner Williams and her vision over 20 years ago, this program is designed to create new affordable housing with the use of some professionals across our state known as regional housing facilitators. They partner with so many different folks across the state, with housing funders, with housing builders, community mental health agencies, and so many others to create this wonderful housing for folks across the state that are living with mental illness or substance use disorders or a combination of both. There is a booth specific for the Creating Homes Initiative that features our regional housing facilitators. So I encourage you to check that booth out as well. Another program within CHI is the Consumer Housing Specialists, and that's a team of professionals across the state as well, who are peers who work to provide education, advocacy, information about and resources about housing and the folks that need them. They are so excellent at what they do. They work to debunk a lot of myths about the people that we serve and about mental illness, and to encourage opportunities to expand housing and identify the right resources for them. There's a booth for them too as well. They're excited to present and share with you. So please check out the booth for the Consumer Housing Specialists. So as I said, I want to kind of connect with some of our team and get them to introduce themselves to you. And as as we mentioned before, that this conference is made possible by funding from one of our programs known as PATH. And Christy Spangler is the lead for PATH. And Christy, why don't you introduce yourself and tell them a little bit about PATH?
Thanks, Naru. PASS stands for Projects for Assistance in Transition for Homelessness. And I get the opportunity to lead this program as the program manager in our office. This program is an outreach program that provides services to individuals who have a serious mental illness and or co-occurring substance use disorder and who are homeless or at risk of homelessness. So our PATH case managers go out into the field and connect with people where they're at, and then they link them to mental health services. And then they work on setting goals with them and helping them meet those goals. And the long-term goal is housing. So that is our PATH program. I'd also like to talk to you all about another program that's really similar to PATH. That's our CWA program. That stands for Children and Youth Homeless Outreach Project. And this focuses on children with a serious emotional disturbance or at risk of a serious emotional disturbance. And them and their families are either homeless or at risk of homelessness. And just like PATH, they provide those outreach services, links the children and the families to mental health services, and provides them additional resources. And their end goal also is to get them into permanent housing. Thanks, Mary.
Awesome, awesome, awesome. And Christy, I know you also know on another program that we're actually excited to expand in this upcoming year, which is that intensive long-term support program. What about that one? How special or how unique is that one?
Yes. The intensive long-term support program, just like you said, we're really excited to expand that program this coming up year. This is a program that provides wraparound services to individuals who are discharging from our regional mental health institutes. So they are able to discharge into a supportive living facility in their community. So it just helps them have a successful discharge and then maintain living out in the community.
That's so awesome. That's so awesome. If it wasn't for that program, we just really would not be able to get some folks who really need to be living in the community. They would just be staying in the hospitals, and we don't want that. So that's a very special program. So want to also kind of pass it over and introduce our colleague Tessa Antonelli, who is with us too. And we're so happy to have Tessa with us on the team. And She leads a very special program known as Community Targeted Transitional Support, which is affectionately known as CTTS. Tessa, why don't you tell them about CTTS?
Thanks, Nehru. So the really cool thing about CTTS is that it's a statewide program. So we are able to help so many people across the state with temporary one-time assistance to prevent people from homelessness or maybe help them out with a utility bill, utility deposit, eye care, dental care, some things that may seem really simple, but actually can dictate if a person will experience homelessness, hospitalization, or maintain their housing, not go to the hospital, and keep really good health, which obviously is one of the first steps in maintaining a really secure life.
Cool, cool. Well, that sounds like really vital to kind of help people in a period where they wouldn't even, they may not know where to get their funding from, and they might be at risk for homelessness. That's really exciting. And one other thing is that we found that that's so successful that we actually have a component like that that's coming for the hospitals, which is known as inpatient targeted transitional support, or ITTS. And Felicia runs that show. Felicia, why don't you tell them a little bit about that one?
Thank you, Nehru. This program provides temporary assistance for individuals that are waiting to be discharged from, or waiting to be discharged, or waiting to be discharged within the last 30 days from our 4 regional mental health institutions. The financial assistance that we do for this program is rental assistance, utility deposits, and one-time transportation assistance, and along with medication copay. This allows an individual, when they're ready to leave and go out into the community, that they're covered and they're financially stable.
Well, thanks, Felicia. That's a very interesting program that you got there as far as ITTS to help folks out during that period when they get to the hospital. They don't have the means to pay for rent just to get them started. So they're for homelessness again. So that gap period from your program that covers that rent and utility deposit is key. And sometimes these folks are waiting for their Social Security application or trying to apply for it, which we happen to have a program for that. So Christy, why don't you tell them about the SOAR program?
I will start off about our SOAR liaison program. This program assists individuals who are discharging from our regional mental health institutes have access to Social Security benefits if they are eligible under the Social Security Administration criteria. They'll be discharging either homeless or at risk of homelessness, and they have a mental illness diagnosis and or a co-occurring substance use disorder or a medical impairment, which causes them not to be able to work and meet substantial gainful activity. So our SOAR liaisons go into the state hospitals and work with these patients through the disability process, or they meet them in the community if they've already been discharged from the hospital. But SOAR is not just specific to our hospitals. Anyone can become SOAR trained in the community. It's a free training, and you can bring SOAR to your community. You can get on to the SOARworks website to learn more about it and to see, to register for the training. The website is soarworks.pranc.com. And we have SOAR coordinators across our state that can assist you through the training or provide support after you've completed the training. So you won't be left alone after you do the training. If you want to learn more about SOAR, once again, check out our website, or you can reach out directly to me. The training's about 20 hours long, but it's completely at your own pace. So I will be happy to help anyone through that or to learn more about that program.
Awesome. Thank you so much for sharing that, Christy. We're so excited about expanding that network for SOAR. So please connect with us about that. And please get trained. It is free, as Christy said. So we would be remiss if we didn't talk about one of our most fundamental programs, which is the Community Supportive Housing Program. That is what we do, is housing. So Felicia, why don't you share with them a little bit about Community Supportive Housing?
Thank you, Nehru. Community supportive housing, which we refer to as CHS, excuse me. It is a statewide program which the provider provides staff, resources, and assistance to fully help the clients, or we call service recipients, to maintain quality, affordable, and safe permanent housing. We have several clients in the community or service recipient, as I said before. They might be living in independent living, or they might live in congregate living or group home living. They come from the community, as I said before, or they might come from one of our RMHIs or crisis stabilization units.
Awesome. Well, thank you for sharing that about that. As you guys can tell, we are so full of a wide variety of programs. Our housing and home services continuum in our state is robust. And we continue to work to do great work. As you can tell, I got a fantastic team behind me, working with me, working alongside me, and we are championing our efforts, and we can't do it without you and your partnership. We thank you guys for being here and visiting our booth. Please check out all the other booths in the expo hall. Please check out the Department of Mental Health and Substance Abuse Services website, and reach out to us at any time. You will find my email address on that contact page, and I will be happy to introduce you to our team. Thank you so much. Thank you guys for being here with me. Have a great rest of your day at this conference.